Hey you guys, welcome back for another antibiotic video in our antibiotic series. Today we'll be covering fluoroquinolones and sulfonamides. Quick disclaimer before I get into anything, as I always do. Welcome to those of you who are new here to the channel. I am Dr. Brittany Weinstock, a family nurse practitioner and founder and CEO of the Nursing Studio. I do videos and resources and materials for nurses and nurse practitioners to aid in their exam success as well as boards and practice. But I always like to give the disclaimer that, there's no absolutes in medicine. And so we treat on a patient by patient basis. So use all of this material as such. If you hadn't had a moment to go check out the other videos that we have done this far, we've been covering antibiotics all month long. So there's videos on, and they're short and sweet, just to kind of give you bite-sized information on the common antibiotic drug classes, as well as bacteriostatic versus bactericidal and gram positive versus gram negative. But let's get into the information for today. All right, so fluoroquinolones, y'all know every time I tell you when we're studying any type of medication, know the endings because there's so many medicines. So when in doubt, if you know the endings and you associate those ending with their drug class and know the mechanism of action, those contraindication, all of those things, those adverse reactions that even when you're stuck or may have never seen a medicine, you can move accordingly in the grand scheme of things, right? So fluoroquinolones end in fluoxetine, like levofloxacin, moxifloxacin, things of that nature, ciprofloxacin, all of those are fluoroquinolones, right? This antibiotic drug class, they are bactericidal. Remembering cytal means to kill. So these medicines are designed to kill the bacteria, right? They are broad spectrum antibiotics, so they treat a wide range of things, but commonly utilized for like respiratory and urinary tract infections. Now, when I speak of respiratory, you may be familiar with knowing that there are also a group fluoroquinolones that are considered as the respiratory fluoroquinolones. And the respiratory fluoroquinolones are your gemafloxacin, your moxifloxacin, and your levofloxacin, right? Those are the three common respiratory fluoroquinolones. And I did an antibiotic video. If you've been following me for a while, I started years ago, but I had a video in a class course that covered the antibiotics, right? And so, I always do my Brittany's Brilliance is what we have come to know to call it now with my crazy mnemonics. And there are weird ways and different things so that we can retain content. So when you're stuck, the hopes is for you to remember it just because it's craziness. And it's just simply that's how my brain works, y'all. Honestly, I hear things, I study things, and my brain converts to something weird, and that's how I retain it. But to me, to remember my respiratory fluoroquinolones, gemafloxacin, so starts with the G, moxifloxacin starts with the M, and levofloxacin starts with the L. So I say, get my lungs, GML, get my lungs, right? Because we're trying to get our lungs together, right? Those antibiotics, those respiratory fluoroquinolones are working to get those lungs, that respiratory system together. We're trying to kill the bacteria in that respiratory tract infection. So let's get my lungs, gemafloxacin, moxifloxacin, levofloxacin, okay? Um, and that is like the overall picture that I want you to think of when you think of fluoroquinolones. Now, it will get a little bit deeper. And like I said, I'm going to do practice questions to kind of gear your mind a little bit to it. But I just want these little short videos to help you quickly identify and say, hey, all right, that's a fluoroquinolone. That's a penicillin, that's a cephalosporin. Hey, this may happen like this. This one works like this. This one works on these type of bacteria. And that's the gist of what I want you to gain from it from these short videos, and then we'll start applying the information to more of a question style and treatment basis and things and contraindications that you should look out for. Okay. Now our sulfonamides, these are the ones that are starts with like sulfa. These are broad spectrum antibiotics as well, but these are bacteriostatic. Remembering that static is to like make it still, stop motion, right? So static is to stop the growth of the bacteria. Remember with these, you want to pay attention to those patient's immune system because we also need the immune system to aid in the wellness in the fight of this infection. Because if the bacteriostatic medicine is just simply stopping the growth in its tracks, we still got to heal through it, right? Whereas bactericidal completely works to kill it, right? Now, those sulfonamides, they're commonly known like the oral ones as well as topical. Topical commonly utilized for burns and things of that nature. Um, some adverse effects from sulfonamides or your vasculitis, your oliguria, anuria, photosensitivity. Okay. Remember, we do not give sulfa meds to people who are allergic to sulfa, and we don't want to give those to the pregnant women either. Okay. Now, I'll just want to go over that because I know I just said a lot really quickly. Just want to hit those little areas one more time. And then as y'all take notes, if you're taking notes, just jot those quick things down. These are almost like video audio flashcards. That's how I look at it for these terms. So you can kind of get it in your brain. And then when I start to add in the questions, I'll start to apply it so that you can get it. So it's just like a slow study series so that it builds on itself. So it's not just like I'm beating you down with so much antibiotic content because it's so much to know, but just breaking it into groups like, hey, I understand bactericidal versus bacteriostatic. Okay, I understand what falls in gram positive versus gram negative. All right, now I know the drug classes, I know their endings, I know how they work, and then now, thinking of what they treat, etc., then starting to apply it. And then, as I always remind y'all, I always say, don't make pharmacology a separate thing to study, but study it along with your systems. I'm simply doing this per a request, but I recommend if you're studying EENT, then study the medicines associated with that as you go, because it just kind of helps you build it on out. But because so many people have so much difficulty with antibiotics, and y'all asked me to do this, I wanted to provide this so that you can kind of get a better understanding and kind of take the overwhelm factor out of it. So as you're doing this and grouping it together with your studies, then you can add it in. And then of course, if you look at my review stuff, that's how I break down the material to try to help with the ease of studying it. But now that I gave you that whole spiel, let's just review this real quickly before we conclude. So fluoroquinolones and infloxacin, they're bactericidal, meaning they kill the bacteria. They're broad spectrum. We also have those commonly utilized respiratory fluoroquinolones, Get My Lungs, the gemafloxacin, moxifloxacin, and levofloxacin. These fluoroquinolones are commonly utilized for our respiratory as well as our urinary tract infections. They're commonly utilized for gram-positive bacteria, but are also utilized with some of those gram-negatives. Those sulfonamides start with sulfa in those medicines. They're broad spectrum as well, but they are bacteriostatic, meaning that they stop that growth of the bacteria. So pay attention to those immune system of the patients, those oral and topical medications. And then, we're not giving it to the pregnant population as well as those with an allergy to sulfa medications, right? They can have adverse effects such as vasculitis, anuria, oliguria, and photosensitivity. Um, and that's just the short and sweet of those medicines. But as always, thank you guys for watching. Be sure to continue to follow, like, comment, and subscribe as I will be doing the practice questions associated with these antibiotics. But also be sure to share with whomever you may think that may find this beneficial as well. And if you would like any of our other resources or want to reach out for any aid and assistance with your studying, be sure to contact us at 803-400-6864. That's 803-400-6864, or email us at the nursingstudio1 at gmail.com. Bye, y'all.